right? Now, this is front. These are the great vessels. You can also look for the auricles. So these are the auricles. The back, the vessels look real different. So you can't see the vessels as well. If you can, it's kind of a big mass. But here you can see the vessels coming off. The ones that are thick walled, these are arteries. So that's one way that you can usually tell an artery from a vein. And kind of what you want to look for, especially on yours there, is you want to look for the pulmonary artery coming right off the front. This one looks kind of weird. This is definitely the aorta. The other way to do it is you can stick your finger or the pointer through the vessel, and then once you've opened it up, see where you end. Which side? Are you in the right or the left, and what's going on? So, and here you can see a lot of fat. So the fat really helps you identify. This is above this line is the atria, right? And then below this is the ventricles, and then there's usually a line of fat that the main blood vessels lie in, and this is the division between right and left. Now, if you're not sure when you open this up, actually I do have that backwards, because when you open this up, look at the thickness of the walls. Right? Which one did I tell you was the thickest? Left. Left. So this is going to be the left, and this is going to be the right. Now, this is unembalmed, so the color is a little different than the ones you're going to be looking at, but these would be really white, and these are the valves. And one way you can tell that is you can see the chordae tendinii, the heart cords, or the tendons, right? And that's what they look like, little muscle tendons. They come right off of these bumps. These are the papillary muscles. And then on the other end, you have the valves. And these are the ones between the atria and the ventricles. So anything, the chamber above this valve is the left atria. And ID this chamber, and that's the left ventricle. So be careful on the test how things are stated. If they use the term chamber, they're looking for atria or ventricle, and you definitely have to say left or right. If they say what layer is the pointer poking through first, then they want endocardium, myocardium, epicardium, or one of the pericardial layers. So if I'm in here and I say name the chamber, left ventricle. If I say what's the layer that this pointer is pushing through, endocardium. So it would probably say what layers is it pushing through first. If I'm pointing like this and say ID the layer that this is pointing through, that's myocardium. And if I point to the outside, epicardium, or what else could you say? Right. Visceral serous pericardium. Right. And this doesn't have a pericardium, the outer bag, but if it did, if it's pointing to the outside of the bag, what layer would that be? Fibrous. If it's peeled back and it's pointing to the inside of the bag, which is shinier, by the way, that'd be the parietal serous pericardium. And then this would be the visceral pericardium, or the, okay? Now, if I'm pointing in this region, I could ask for a bunch of different things too. ID the artery that runs in this region. Anterior intervertebral artery. Okay. Name the vein that runs in this region. Right. The great cardiac vein. Name the groove that the pointer is in. Anterior interventricular sulcus, because that means groove. Okay? So be careful what the question asks you for. These are the auricles. They're flaps hanging off. And here, this is how you can tell the vessels. This one, which is coming right off the middle. Which one's that? This is the front. No. Pulmonary. So this is the pulmonary right off the front, and then just behind that is the aorta. Okay? When you come to the right side, you can try to find the superior vena cava and the inferior vena cava. Another way to do that is to go to the right atria and find the hole, right? Because there's going to be a hole that it comes out right there. And on some of these, it's really cool because you can take the pointer, and some you can and some you can't, poke it through this hole